Hi, today we will go talk about chronic inflammation. Basic principle of this topic is characterized by the presence of lymphocytes and plasma cell in tissue, delay response but more specific adaptive immunity than acute inflammation. Stimuli include persistent infection, most common cause, a second cause is infection with viruses, mycobacteria, parasite and fungi, autoimmune disease, foreign material, and some cancer. T lymphocytes produced in bone marrow as progenitor T cell. Further develop in the thymus, where the T cell receptor undergoes rearrangement and progenitor cell become CD4 positive helper T cell or CD8 positive cytotoxic T cell. T cells are used to TCR complex, TCR and CD3 for antigen surveillance. TCR complex recognize antigen present on MHC molecules. CD4 T cell recognized by MHC class 2 and CD8 T cell interaction with major histocompatibility complex class 1. Activation of T cell requires is binding of antigen and major histocompatibility complex and addition the second signal. CD4 positive helper T cell activation. Extracellular antigen foreign protein is phagocytosis proceeds and presented on MHC class 2, which are expressed by antigen-presenting cell. B7 on antigen-presenting cell binds to CD4, CD28 on CD4 helper T cell, providing second activation signal. Activated CD4 positive helper T cells secrete cytokines that help inflammation and are divided into two subsets. T helper 1 subset secrete interferon gamma, which activates macrophage and promote B cell class switching from immunoglobulin M to immunoglobulin G, promotes T helper 1 phenotype and inhibits T helper 2 phenotype. T helper 2 subset secretes interleukin-4, facilitates B cell class switching to immunoglobulin E, interleukin-5 eosinophil chemotaxis and activation, and class switching to immunoglobulin A, and interleukin 13, function similar to interleukin-4. CD8 positive cytotoxic T cell activation, intracellular antigen derived from protein in the cytoplasm, is processed and presented on MHC class 1, which is expressed by all nucleated sentinel platelets. Interleukin-2 from CD4 T helper 1 cell provides second activation signal. Cytotoxic T cells are activated for killing. Killing occurs via secretion of perforin and granzyme. Perforin creates pores that allow granzyme to enter the target cell and activates apoptosis. Expression of Fas ligand, which binds to Fas on target cell, activates apoptosis. B lymphocyte. B lymphocyte is immature B cell are produced in the bone marrow and undergo immunoglobulin rearrangement to become naive B cell that express surface immunoglobulin M and immunoglobulin D. B cell activation occurs via antigen binded by surface immunoglobulin M or immunoglobulin D, result in maturation of immunoglobulin M or immunoglobulin D secreted plasma protein. B cell antigen presentation to CD4 helper T cell via MHC class 2. CD40 on B cell bind to CD40 ligand on helper T cell, providing second activation signal. Helper T cell then secretes interleukin-4 and interleukin-5, mediates B cell isotype switching, hypermutation, and maturation to plasma cell. Thank you. The next topic is chronic granulomatous disease.